Knowledge means power. In the eye clinic, knowledge means vision. Liz is a very short-sighted, also called highly myopic patient, and she has some holes in her retina that produced Rhegmatogeneous retinal detachment in her right eye, as you can see in the small middle left drawing. She needs to have the retina fixed as soon as possible through an operation called Pars Plana vitrectomy, and to have the retina treated with laser to seal the hole that produced the retinal detachment. If you want to know more, keep watching. Hello everyone, I am Dr. Narcisa Ianopol, an eye doctor, eye surgeon, and clinical researcher in ophthalmology. I was trained and practiced for 28 years in European countries like Romania, Germany, United Kingdom, and United States of America. I prepared the collection of online courses for patients' education called Explain Me Simply, that is dedicated to people and patients like you willing to learn science and experience in the diagnosis and treatment of eye conditions to prevent blindness. These courses are published on my website iStory with Narcisa at the link in the description below this video. My mission is to empower people by getting knowledge and learning from my experience that I got through my trainings from 4 mentors, 2 from Europe and 2 from United States of America. Then I improved by seeing every day thousands and thousands of patients like you with ocular problems from all subspecialties in ophthalmology like retina clinics, cataract, glaucoma, neuro-ophthalmology clinics, uveitis, ocular trauma, acute clinics, etc. This is the volume 5 of this collection, and it is entitled Explain Eye Surgeries. Liz has retinal detachment and she needs an operation called vitrectomy to fix her retina. I explained to her what are the risks of this operation, the rate of success, what she should do after this operation if she will need a gas bubble put in her eye or silicone oil. What is in my mind? That I would be scared to death to have this operation done in my own eye. Yeah, you did hear right. I would be scared to death to have any of these operations done in my eyes, and I do not know a surgeon that I would let to touch my eye and operate me, not even my 4 mentors in retina surgery. And yes, I do myself these surgeries for 28 years, and my mentors are between the best surgeons in the whole world doing retina surgery. Yet I am still very scared to let anyone to touch my eye because I know very well how many complications can happen in a blink of an eye during surgery. Also, the things can go wrong very simply after surgery. However, Liz would be blind in her right eye if the operation to fix the retina would not be done as soon as possible. Liz is a very brave 56-year-old woman who trusts in me as her surgeon, and I need to do the best for her in all the steps, from all the explanations before the surgery, then the operation to fix the retina, then to take care of her after surgery. If you want to learn more about the story of my patient Liz and useful information about eye surgeries by classic surgical techniques and laser techniques, keep watching. And at the end of this video, take the online course, Volume 5, Explain Eye Surgeries, to learn even more. This video may save your vision. Before we start, I would like to advise once again that even though I am a physician with trainings and practice in multiple countries in Europe and United States, all of my online courses and other published materials, including the Volume 5 Explain Eye Surgeries, are designed for education only. They do not offer any medical advice for anybody. They were not created for other teaching faculty or other healthcare providers. They do not pretend to be complete. And very importantly, I have no financial interest in promoting any treatment, any surgical or laser procedure, and any surgical product of any medical company or tech industry. My single priority is teaching and education of the patients about real science about all of these treatments in ophthalmology. For more information about these disclosures and the purpose of this teaching activity, please read the chapter Disclosures and Agreement, Privacy Policy of the website iStory with Narcisa. Just click the link on the slide. Some people may wonder why to understand your eye surgery. And the answer is this: because by understanding your operation, first of all, you know your situation the best, and you can help your doctor to choose the most suitable surgery for your case. Second, and very importantly, you will sign consent knowing what you are waiting for, and you will believe well. This is a kind of magic in positivity, and this way to believe well that is not too much explained but is universally accepted. People believing well go better even after the surgeries, not only in their regular life. And finally, but not the least, you will understand your doctor recommendations after the operation, and you will follow the instructions knowingly. Visit the website iStory with Narcisa to get empowered by knowledge from all 5 volumes of the collection of online courses for patients' education. Explain Me Simply at the following link on the slide and below this video. In the next slides, I will tell you what do I teach in the Volume 5 Explain Eye Surgeries of the collection of online courses for patients' education. First of all, I would like to advise that I only speak about things and facts that are accepted by almost all the surgeons all over the world, and I do not enter in details or discussions about surgical techniques that are done in a way by some surgeons and in a completely different way by others. Though all this information in my course are generally accepted, after you read my course, you will still need precise advice of your surgeon who examined your eyes and adapted the general surgical techniques to your particular situation and diagnosis. What you will learn about each of these surgical techniques I describe in this course. You will learn relevant anatomy and functions of the eye, information about ocular disease condition operated by that surgical technique. You will see explained the surgical technique or operation in the eye. You will learn generally accepted tips and recommendations after surgery, and you will see the rate of success and complications. Visit the website iStory with Narcisa to get empowered by knowledge from all the 5 volumes of the collection of online courses for patients' education. Explain Me Simply at the link in the slide and in the description below. The part 1 of the course speaks about main surgical techniques for squint, also called strabismus, eyelid surgery, tear ducts and lacrimal system in general, also orbital procedure in patients with thyroid disease and exophthalmia, also called bulging eyes. In the part 2, I teach the main procedures for the cornea, like corneal transplant, cataract operations and replacement of the lens of the eye, glaucoma surgery, and similar operations. The course is written simply for everyone to understand and take practical information to help them getting the best visual recovery. Visit the website and take the course on the link in the slide and also in the description below this video. The part 3 teaches different procedures that are done in the frontal part of the eye and on the back of the eye, called pole-to-pole surgery, that are used in the operations on the back of the eye, called vitreoretinal surgery, but also in cases with ocular trauma. The course offers a unique new way of teaching patients so that they get the best tips and help to understand better their own doctor's recommendation. The vitreoretinal procedures are difficult to be understood if the explanations are not done for patients on drawings. This course offers a unique new approach and explains simply and efficient all of these vitreoretinal procedures done nowadays in the eye clinics to save the vision in patients with problems of the back of the eye. Visit the website iStory with Narcisa to get empowered by knowledge from all 5 volumes of the collection of online courses for patients' education. Explain Me Simply at the link in the slide and on the description below. The part 5 teaches basic information about the main laser surgeries done in the eyes nowadays that were not available many years ago. These procedures save the vision in millions of people all over the world. To follow correctly the instructions of your own doctor and surgeon can be done only if you understand what they are doing and why they gave you all of these instructions. So do not lose the opportunity to understand simple explanations about all the procedures that may save your vision. Visit the website iStory with Narcisa to get empowered by knowledge from all 5 volumes of the collection of online courses for patients' education. Explain Me Simply. All these courses are available in PDF and also video format on my website so that they will serve all people, including patients with visual disability or hearing impairment. I invite you to take the mini course Volume 5 Explain Eye Surgeries. You will learn what you must know if you are going to have a surgery on your eyes. If you like this video, please give a thumb up and please subscribe to my YouTube channel to know when I publish more videos like this about new materials for education and research. If you want to learn more about the other volumes from the collection of courses for patients Explain Me Simply, see the short videos about each of them in the playlist. See you on my website for taking the course or on my next video. God bless.